It's Monday, September 14th, 2020. Hey everyone, welcome to the fall semester. I'm going to try to do a little bit different of these video messages. In the spring, I primarily was just giving you a check-in, letting you know some high-level things that were happening from my own or the university's perspective. Here in the fall, I'm going to be focused much more on what's going on in our faculty. So I'll give you some updates on things that are specific to us and things that are from the university level that are, again, having great or very strong connections to what we do in the Faculty of Health, Community, and Education. In today's video, I'll talk about a couple things. First, Healthcare Simulation Week is this week. Second, an update from General Faculties Council and the adoption of a statement against the genocides that happened in residential schools. Third, I'm going to give you an update on our Strategic Plan Implementation Committee, a short update on the Academic Working Group, and then I'm going to share with you what we got coming up in the next little while. Some exciting things happening this week is Healthcare Simulation Week. The Simulation Learning Center have put together a CPR challenge. I participated, as did Liz Van Kerkhoff. I believe Yasmin, Maggie, Genevieve all participated. Some instructors participated. The president, Tim Raleigh, and the provost, Liz Evans, participated as well as some others. So check out Instagram. That's where the Health Simulation Learning Center will be posting the results all this week. It's a bit of a contest, so I'm kind of nervous. I'm not sure how I did compared to the others, so look for that. But please follow Instagram, the MRU Health Simulation Learning Center. The link will be in the description below. The first meeting of General Faculties Council happened on Friday. It was both an orientation as well as the first business meeting of the year. The most important business item was a motion that was brought forward for Mount Royal to recognize the genocide that has happened in residential schools and the impact on First Nations people. General Faculties Council passed the motion unanimously. There were no votes against the motion. There were some abstentions, however, there were 0 no votes. The next step will be for our president, Tim Raleigh, to take this statement, which General Faculties Council has endorsed, and take it to the Board of Governors and see if they would also endorse it. I'm going to read for you the statement. It's quite impactful. Mount Royal University acknowledges the genocide done to Indigenous peoples by colonization and the trauma inflicted by the residential school system, and supports the ongoing work of reconciliation, including the objectives set out in the report of the Truth and Reconciliation Commission of Canada. This acknowledgement brings a responsibility to provide a culturally safe learning work environment in accordance with the Truth and Reconciliation Commission's findings and Mount Royal University's Indigenous Strategic Plan. Mount Royal University is committed to strengthening our commitment to decolonization, as stated in the 5 goals of our Indigenous Strategic Plan. We will, number 1, cultivate respectful and welcoming environments that prevail over the legacy of colonization. Number 2, foster respect for Indigenous ways of knowing and knowledge production to increase capacity for Indigenous scholarship. Third, build strong connections by forging mutually supportive and productive partnerships with all stakeholders in Indigenous education. 4, work with our communities to enhance the academic, personal, and cultural experience of Indigenous learners. And 5, promote culturally responsible and respectful curricula that integrates Indigenous pedagogies and ways of knowing. It really is an impactful statement, and I'm quite honored that General Faculties Council adopted this unanimously. This past week, we also had the first meeting for this year of our Strategic Plan Implementation Committee for HCE 2024. Our plan is based on the Blackfoot narrative of the spiderweb, Anito PC, as taught to us by Elder Roy Bearchief. This past 6 months has seen so many different vibrations in that spiderweb, and it's really important that we follow the story which is the vibrations are a signal, but it's important that we get to actions, that we respond to those vibrations, send help and support to the areas of need. There are many areas of need, and I know that we're all working hard to address those. The topic we spent the most time on was racism, and what are the things that are identified in our strategic plan and that we can do to combat racism. Racism that occurs at Mount Royal, in the Faculty of Health, Community and Education, and in our communities. Two ideas that were raised that I think we're going to proceed with. The first, we're going to look for an opportunity to update our strategic plan with not a report card so much as really just a check-in and update. Where are we? What have we accomplished so far? And what are the priorities going to be for this upcoming year? Secondly, we want to create a safe space where people that are facing racism, that might be Black, Indigenous, people of color, give them an opportunity to tell their stories in a manner that allows us to learn from this and figure out ways that we can address the racism that is happening. One of the ideas was to really do it as an educational opportunity where if we can collect some examples anonymously and then share them through our newsletter or through other venues, it allows people to be aware of what are the things that people are facing, that those of us that are not facing those same behaviors aren't aware of, things that we're blind to, and so it's an opportunity for us to learn. As you know, I'm on the academic working group, which is working hard with the Planning Ahead team, so Pat and AWG, trying our best to look at how are we moving forward in delivering this fall semester. What does a relaunch, a reopen mean as we have started to do various things? Recreation is reopened. We have the library first floor open. There has been over the last couple of weeks an increased number of people on campus. Speaking of people on campus, and spoiler alert, we need people to fill out the daily wellness check. I've got some numbers for you in regards to the number of people that have been on campus for some of the days over the last 2 weeks and how many of them also completed the daily wellness check. On Friday, September 4th, there were 189 different cards swiped by students. Of those, 147 had completed health check for a 78% completion of the health check. On the employee side, on Friday, September 4th, there were 247 different individuals that came to campus, and 134 of them did health checks for a 54% completion rate. On Tuesday, September 8th, there were 610 forms completed. Of those, 168 by employees, but there were 209 employees on campus, so the completion rate was 80%. Great improvement from the Friday. For students, we had 352 on campus and 434 filled out the form. The compliance rate there is 123%. So we had a whole bunch of students fill out the form and not all of them came to campus. And then on Wednesday, September 9th, there were 197 forms completed with 292 staff on campus, 67% completion. 373 students filled out the form, but there were 591 on campus, 63% completion rate. And then on Thursday, September 10th, we had 212 employees complete the health check, 295 were on campus, so 72% completion rate. For students, we had 420 forms completed and 541 people on campus, so 78% completion rate. As you can see, except for that one anomaly of more students filling the form out than coming to campus, we have people on campus that have not filled out the daily health check. So we need to play whatever role we can in helping to encourage people to please do those. In conclusion, if you're coming to campus, please fill out the daily wellness check and make sure you swipe your card when you first enter the building. Coming up, this week is Healthcare Simulation Week, September 14th to 18th. We have a variety of program reviews. Our faculty have been working exceptionally hard. We have program reviews in 3 out of our 4 departments and covering many, many programs. Reviews coming up include, we've got the Bachelor of Social Work Program Approval CAQC site visit from September 28th to the 30th. Shortly after, the Bachelor of Child Studies program review with 2 majors and an accreditation site visit are happening October 5th and 6th. And then about a month later, the Bachelor of Health and Physical Education program review with 4 majors. We'll have their site visit on November 2nd, 3rd, and 4th. Also coming up, we have a town hall by the President and Provost. It will be on Wednesday, September 30th from 11 till 12. Orange Shirt Day is coming up. It is also Wednesday, September the 30th. The annual Orange Shirt Day, which started in 2013, is to open the door to global conversations on all aspects of residential school. I encourage you to wear an orange shirt that day. Building on addressing racism, the University of Toronto will be hosting a National Dialogues and Action for Inclusive Higher Education and Communities on October 1st and 2nd. It will be entirely online. The information on how to sign up for this is in the newsletter. This year it's about racism and what can we do at universities to respond to and address the systemic racism that exists. And the last reminder I have is that our Faculty Council is coming up on Friday, October 2nd from 9:30 to 11:30. I know the semester has started for all of you. I know it's an exciting time, seeing students, having the opportunity to welcome them back online for most of it. This is very exciting, and I know you are doing great things. I have a Dean's message in today's newsletter. It'll be slightly different than this one, but I will repeat some of the things. And my next newsletter Dean's message will be in a month, but I will do another video in 2 weeks. So have a great 2 weeks, everybody. See you soon.